on airplane mode so no one can call me or nothing. Yes.
Hello, hello.
Hi.
Hello.
Hi, Mr. Perry.
Yes.
How are you doing? I'm Dr. Raza. Nice to meet you, sir.
Nice to meet you.
Hello, how are you doing?
Fine.
I actually have already reviewed all your information, so I'm going to just stand here. Because I sit over there, I won't be able to see you.
Okay.
And in order to maintain social distancing, it's kind of weird, but
Yeah.
we're in a triangle.
Right.
Alright, so I know that you've been having some chest pain, is that right?
Yeah, chest pain, shortness of breath, lightheadedness, and mild headaches. And, the headaches only last for probably 30 seconds. Just when I get lightheaded sometimes, I'll just get like a sharp headache, like right in this part of my head. And then if I sit down and just rest for a minute, then it goes away.
Okay. And how long have these symptoms been going on for?
Since April.
Since April?
Yeah.
I see that you saw a cardiologist at Kettering and you had a stress test and an ultrasound of your heart, is that right?
Yes.
Okay. How are your symptoms now? About the same or have they changed?
I think they're about the same. She said she thought my color was a little better yesterday than it had been. I don't know if that means anything or not.
So did these symptoms just come out of the blue or were you like slowly coming down with them for like a few years?
I had a like a flu bug in the beginning of April. And ever since then, it seems like I've just been tired, exhausted, feeling that you can't hardly do anything, and I could be sitting there and watching TV, and then I can just feel my heart beating faster.
Okay.
And I don't know why it would do that. And my other cardiologist that I seen, I told him, you know, she's got this little thing that she puts in my finger for oxygen and heart rate and stuff, and sometimes it would go up to 135 to 125 just for no reason, and then go back down to 80. And he said that was normal, but it didn't seem normal to me because I don't recall it ever doing that before.
Okay.
And he had spells where just suddenly, now this is a drastic, acute change. He's a man that works from the time he gets up till the time he goes to bed. And now all of a sudden he can't walk across the room without sitting down. He had periods where, and why we had the test was because he was tachycardic and his blood pressure was super high.
Okay.
And it wouldn't come down. And he thought he was going to pass out, and we ended up at the emergency room, which is why we went to Fort Hamilton, because he had to go 911. He couldn't walk to the car. But we weren't happy. They did some things that weren't careful, so we wanted to get a second opinion.
Did they discuss the results of your stress test with you?
Yeah, at that time at the hospital, they told me they were normal, but then when I got home and I got a message saying I got a new thing in my chart or whatever, and then on my chart it says abnormal results. And
So, you know, honestly, your results were equivocal. So, I looked at the reports in the chart. So, the stress test, if you recall, you did two parts, right? You did the part on the treadmill,
yeah,
and then the second part was under the imaging, right?
yeah.
So, basically, it's adding more value to the test. So, the EKG portion of your stress test also came back equivocal, meaning it wasn't positive, but it was a negative too. You had some EKG changes, but they resolved immediately. So, you know, if you didn't have any, we would say it's negative, but you had some, so they called it equivocal. And then your imaging portion also had some issues with it. You know, you had a defect which was showing up at rest, and then it was different at stress, so they felt that maybe it was because of attenuation. Attenuation basically means that it was an artifact, maybe, but the way they reported the test, they said that we're not 100% sure, it could still represent some ischemia. So from
Yeah, on the
this test-
stress test, they had to stop it because I couldn't continue anymore.
Okay.
When she said that, when I reached the targeted heart rate,
Right.
and that's when I couldn't go. I tried and
Right.
I got dizzy feeling
You
and
were on the
lightheaded.
treadmill for approximately 7 minutes before they stopped it. So,
Yeah.
so at this point, I think there's the next step at this point will be, do you have any blockages or not in the arteries of the heart? That's going to be a big piece of solving this puzzle.
Yeah, that's what I thought they was testing me for because they put some dyes in me
Right.
when the stress
But
test.
the only shortcoming of the nuclear stress test is, it's a great test because it's a non-invasive test, but sometimes we run into issues like this, in which the test is like inconclusive or it doesn't give us the information that we need.
Yeah.
So now, I think probably more than likely, you don't have any blockages, but again, with the things that we saw on the test, we need to investigate this a little further.
Mhm.
Now, the next step would be is to do an angiogram in which we look at the arteries directly.
Mhm.
We can't repeat another stress test now, that's just not a good way to practice, repeat the same test over and over again. So we can do an angiogram. An angiogram is a test in which we actually look at the arteries of the heart and make sure there are no blockages. Now, since my index of suspicion for you is on the lower side, that you have blockages, I can offer to you a cardiac CTA. It's a CT scan that is an angiogram. The advantage of doing that over a regular angiogram is that it's not an invasive test. So you don't have a risk of bleeding, there's no risk of the complications you can have. Now, even an angiogram, a regular angiogram is very safe.
Mhm.
But I feel like if you can get away with a non-invasive procedure, why not?
Right.
The only downside of a cardiac CT is, again, it's a non-invasive test, so there can always be cases in which it can be inconclusive. Meaning, let's say, if they go in and we find like there's a blockage in your CT scan. Sometimes what happens is because there's calcium, the CT scan cannot tell us if it's moderate or if it's severe.
Mhm.
So in that situation, we go back and we have to do the actual angiogram. But if overall the CT scan was completely clean, then you're done. Okay, then we kind of look at other things that could be happening that could be making you feel the way you are.
Uh-huh.
So some patients are like, no, I just want to do the angiogram because I want a definitive test and get done with it. And if something needs to be fixed, I just want them to fix it. Again, if my index of suspicion was super high, I would have just said, just do the regular angiogram. But I think this will probably come out okay, so we can just do the cardiac CT.
Okay.
What do you think?
I don't know. What do you think, man?
Well, I don't know more than the doctor.
If
But-
it were
but
me,
we
I would
do
the
need to-
cardiac CT, to be honest.
We do need to figure it out because you're not okay, and I don't know how to protect you, what to do.
And it's just a CT scan. Again, you're not going to be, it's not risky. I think it would be a good test for you.
Okay. I've had one CT scan already.
So-
Is that different? Or?
Yes, this is going to be a cardiac CT. So let me give you an example. So here you are sitting right now. If I take your picture, I'll get a good picture, right?
Mhm.
But if you're running, I try to take your picture, it's going to be a fuzzy picture.
Yeah.
The same holds true for the heart. Unlike any other body organ,
Mhm.
the heart is the one that moves the most, right?
Mhm.
Everything else is still. So if I do a CT scan to look at your lungs, it'll give me a good picture of the lungs, but it won't give me a good picture of your heart.
Okay.
So the CT
I had a
scan-
lung scan before.
Right. So the CT scan for the heart is something which is a completely different sort of a technology. And for example, your heart rate right now is 86.
Mhm.
So
And when I wake up in the morning, it's like
Huh?
66, and then
Right.
but then after I get up and start moving around.
which is perfectly normal. But for the test, we would want your heart rate to be 50 and under. So before the test, we will give you medicines to slow down your heart rate. This is just for the test.
Okay.
And the rationale is that we don't want your heart to be so fast that it gives us a fuzzy picture.
Right. Right.
Make sense?
Yeah.
Is that for the whole heart?
Yes.
Okay.
It's gonna just look at everything.
Do we have to schedule that, or is that something we can get done right away? This has been a long time. He needs to.
It will need to be scheduled.
Okay.
Yes, I will order that for you and it will need to be scheduled.
Okay.
We'll go from there. And the good news is on your past testing, there wasn't anything super alarming, but it just wasn't, and we don't know, that's where we're at. We kind of, where we started off, you know, we don't know if it was normal, it was just, they call it equivocal. Equivocal just means do something else.
Yeah, and like, I guess I'm kind of concerned just with the episode where I had to go to the hospital, because I just had left Myers store, and I was walking, I had a cart and everything, and I just started feeling funny.
Right.
And I thought, I need to leave.
Right.
And so I went home, and when I got home and got out of the car, I just felt really weird feeling,
Right.
and like my heart was racing. I felt like I was sweating. I don't know if I was or
Has
not.
it happened again like that or no?
No, not since then.
But it happened once before that.
Have you ever been diagnosed with something like a supraventricular tachycardia or atrial fibrillation? Does that ring a bell?
No.
No. Here's the thing now. You could have had like an episode of what we call an arrhythmia. So when you look at the heart, there's like different components to the heart, right? So there's a blood supply to the heart, and there's an electrical current system of the heart. And even though they work in conjunction, sometimes people can have problems of one system or the other. So sometimes you have patients whose heart starts beating really fast with no reason, without any reason at all. Sometimes you have patients whose heart starts beating too slow, you know, and those are the sort of patients, the slow ones that require pacemakers. What I can do is, let's do the CT scan first. Now, it's difficult for me to tell you what happened back then, right?
Right.
But let's say if it continues to happen again, we can put a monitor on you.
Yeah,
For
they
1
got
month.
one on me.
Oh, you already have one on?
Yeah, I got this.
Oh, but have you heard from them or no?
No, not yet. I got
Another week. I think it was for 30 days.
No,
Two
but they
more
haven't
weeks.
called you or anything like that, because, so this is a live feed, right? So if something abnormal would have
They
happened,
give me,
they would have called you, so it means that it's been fine thus
they give
far.
me this.
Yes.
to
Yes, this is
put
awesome.
stuff
So you already have that, so this is also gonna be very helpful for us.
in. Okay.
They would have left a message, I guess, because he doesn't normally answer numbers he don't know.
Right. What they do is like if they find something alarming, they immediately call you.
Okay.
Yeah,
Okay.
so we're good, I guess.
Okay.
Let me examine you, okay?
Okay.
So that's good, you already have that on, so that takes care of one thing.
Yeah. And I try to monitor stuff. I forget because I'm not used to
It's
it.
okay, this is doing the job for you,
Okay.
right? So even if you lead your normal life,
Yeah.
and sometimes these episodes happen once and they never happen again.
Yeah.
You know, that's always a possibility too. But what we want to make, yeah, and what we make sure is that there's nothing
I thought I was dying.
bad that
Well,
happens.
and in the in-between time, though, he's still not able to go down the stairs or
Yeah.
do anything he could do before,
Right.
so,
Have you ever smoked?
Yeah, that's what.
long time.
Okay.
Yeah, for
Have you ever
44
been checked
years.
for like like COPD or asthma?
He just
Yeah.
got diagnosed with mild COPD.
Yeah.
Did they give you an inhaler?
Yeah, inhaler. Yeah.
Has that helped?
Yeah, somewhat.
Okay. That's pretty normal.
Oh, that's normal.
Someone else to turn your face to that side? It's pretty normal. Sounds good. Alrighty. So this will go back to them. So when you send it back, remember to give us a call so we can keep on an eye out for these results.
Yeah.
Because if you send it back, it takes roughly 7 days to 10 days before it gets actually reported out.
Wow.
So, because first you will send it to the device company, then they will upload it to the doctor. So,
I also, I don't know if you know anything about it, but I recently, 2 days ago, I got this knot on my leg right here. I'm not really sure what it is. It's kind of painful, but it's not bruised or.
Right here?
It's been longer than 2 days.
seems like a cyst to me.
Doesn't it?
Yeah, feels like a cyst over there. Could be like a tendon cyst or something. Yeah. keep an eye on it. If it doesn't improve, or if you develop a fever or something like that, talk to your primary care doctor.
Okay.
Highly unlikely it's an abscess, but I could feel it. It feels like a cyst.
Okay, yeah, and I got like, up here, on this here, but that's been here for about 5 years.
Okay.
And my regular doctor
Okay.
told me it was a fatty,
Yep, if that feels like a cyst or lipoma or
and
something
this
like
one's
that.
more painful.
Like I said, if you've developed a fever or over-like skin redness, just call your PCP.
Okay.
Any questions about the CT scan?
No, you have any?
Not yet.
Okay. So you will get 2 pills. It'll be weird because your pharmacy will be like, they only ordered 2 pills for you. But, I forget, but do you take metoprolol or carvedilol?
Nothing. He's not.
So it will be a pill called metoprolol. You will take one the night of the procedure and one the morning of the procedure. That's
Okay.
it. Okay? And the reason we're giving that to you is to slow down your heart rate.
Okay.
Okay? Alright,
Alright.
I'll order that for you. Thank you.
Okay.
Thank you. Oh, and he'll have to maybe bring you some FMLA papers to fill out till we get. Okay.
What will that be for though?
Huh?
What will be, like, what do you do? What do you, where?
I work at the post office.
Okay,
Throwing packages and he can't even walk 5 feet.
okay. You also may wanna give it to the doctor who did all the testing initially, because you're also in the ER over there.
Mm-hmm.
Because I can only, document from today onwards.
Right, right. Well, we have it from
Oh,
before.
okay, yeah, cool, then I can do that.
Okay, thank
Alright,
you.
thank you.
Hurry up and wait some more.
So do I have to get another FMLA paper for her to fill out?
Well, you said it ran out this week.
Yeah.
Yes. Or we can just give her your other one, she can add to it, or whatever.
I got one at the house, I didn't think to bring it.
That's okay.
Not filled out, it's printed out.
That's okay.
Although I didn't get the signature copy. Because the doctor,
Well, it would be her signature anyway.
I had to take it to Dr. Wheeler.
Lonnie, you alright?
Yeah.
It's frustrating, isn't it?
Mm-hmm.
Okay.
I just want to make a paycheck, man. I can't.
Well, maybe God's trying to teach you to learn something else. Hurry up and learn it.
I'm learning how to be a pulmonary doctor.
Right.
Well,